Hello and welcome everyone. Welcome to Scholars Hub at Home. I am Isa Abdi-Jama, Alumni Engagement Officer at York. Thank you for joining us for today's lecture, Partnerships for Safe and Sustainable Transportation, presented by Alison McPherson, Professor, School of Kinesiology, Faculty of Health. I would like to take a moment to acknowledge the land I am on because we may not be gathered in the same place. The land I'm about to acknowledge might not be for the territory you're on. Please take the responsibility to acknowledge the traditional territory you're on. The website nativeland.ca is a good resource for this. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaronto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It's now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon, One Poem Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Now we would like to conduct a quick poll before each session begins. The question is, how will you rate your knowledge regarding this topic of today's presentation? The poll should pop up on your screen right now. I'll give everyone a moment to complete the poll. Thank you. It's helpful for our speakers to know more about who is in our audience. If you need help with Zoom webinar, please feel free to click on the Q&A function at the bottom of your screen and enter your question. Our team is ready to help you. The same function may be used to submit questions for a guest speaker to answer during the Q&A period. Please note that all your questions and comments are visible to our panelists and staff working behind the scenes. We ask that you keep your comments relevant and respectful. Now, I would like to introduce Dr. Alison McPherson. Dr. McPherson is a professor in the School of Kinesiology and Health Science at York University and an adjunct senior scientist at ICES, an Ontario not-for-profit organization whose mission is translating data into trusted evidence that makes policy and healthcare better and people healthier. Her research is related to keeping kids active, healthy, and safe, including promoting the use of equitable, active, and sustainable transportation. The research program focuses on the prevention of childhood injuries, primarily through policies and laws designed to reduce injuries. We are so pleased that you could make the time to join us today, Dr. Alison. Welcome.
Thank you so much, Isa.
Thank you, and please share your screen, and I will be back after your presentation for the Q&A period.
Perfect. Can everybody see that all right? Okay,
Yes.
so thank you for coming to hear this talk, and it's a topic that I'm very passionate about, and it's municipalities partnering with academic researchers for safer and more sustainable transportation. So I just wanted to give you a brief overview of the presentation. I always like to start with a bit of justification, and especially as some of you have said you don't really know much about this topic. I think it's important to kind of situate it and explain why it's important. I'm going to share some previous research on pedestrian and cyclist injuries. I'm going to share study findings also from the CHASE study, which is the Children's Healthy, Active, and Safe Environments. And I'm going to focus on health equity in the built environment. And I hope that by that point, you'll understand why I think health equity is so important. I'm going to share some of the products that we have created, and what we use what's called co-creation, and that we create them in partnership with the people who are going to use them so that they will be most likely to be useful. Then a couple of evaluation projects, and then a conclusion. So why is working in partnerships with municipalities important? Well, our municipalities across Canada make most of the decisions about changes to the built environment to promote sustainable transportation. And so, for example, those of you in Toronto have probably noticed that there's been a dramatic increase in the number of separated bike lanes built along Bloor, for example, and along Yonge Street. Well, municipalities make those decisions to make those changes to the built environment. They also bring a very different lens than researchers. They have a lot more people to answer to. They have to be able to convince city councillors and the public that these changes are important and they're an improvement. And if they're treated like respected partners, they welcome input from researchers, particularly around evidence and evaluation. And we'll show you a couple of examples of that. So why is researching and promoting safe, sustainable transportation important? Active transportation is sustainable transportation. Walking and biking is better for health, better for the environment. And, in this time of climate change, it's really important for us to consider ways we can promote. In my field, particularly, it's mostly children biking and walking to school. But there's lots of evidence that shows that if children start young, biking and walking to school, those are lifestyle changes that they'll make throughout their life. Active transportation is also an equity issue. People who cannot afford to have a car have few other choices. People unable to drive have few other choices. And those people unable to drive could be children, they could be older adults who are no longer able to drive, they could be people with various disabilities. So if they live in a very car-friendly environment, it's harder, much, much harder for them to get around. And our previous research has shown that people in more marginalized areas are more at risk of vulnerable road user injuries. And this chart is from a study that we did that we published in 2019. And it's pedestrian motor vehicle emergency department visits per 100,000 children in Ontario from 2008 to 2015. And the darkest blue is quintile 1, which is the lowest income, and the white is quintile 5, which is the highest income. So we can see that among the poorest children, the percent of pedestrian injuries went up by 14%, but the highest income quintile went down by 22% over this time. So I think it's really important to keep this in mind, and of course, there's lots of things that could explain this, but it really shows that we have to make our built environment safer for our most vulnerable population. Injuries to pedestrians and cyclists are preventable. Reducing speed, separated bike lanes, and other changes to the built environment reduce the number of vulnerable road user collisions, injuries, and death. In Toronto, and I'll show you some maps, traditionally there were fewer road safety features. So one example is traffic calming in more deprived areas, also the bike lanes. And that's because things are initiated by a process of request. So if you want a speed hump, for example, as traffic calming on your street, traditionally you had to get everybody on your street to get together. You had to submit all sorts of forms, and the decision is made by warrants, like, is this change warranted according to the city? And you can imagine that for people who are working two jobs or people for whom English is not their first language, that might be a much, much more inaccessible request than, having the city decide where things should be placed. So this is some research of child pedestrian motor vehicle collision hotspots. So on the left, you can see in Northwest Toronto, this is the city of Toronto. So there's 6 child pedestrian hotspot clusters in Toronto. And so Northwest Toronto, in the East End, and downtown. And then if you look on the right-hand side, that map shows the speed hump density, so where there's the most traffic calming. And you can see that where there's the most traffic calming does not match up with where it's needed, where children are getting hit by cars. So injuries to pedestrians and cyclists are preventable. We talk about the Vision Zero approach. Vision Zero is a safe systems approach that has worked in many other cities, including in Nordic countries such as Denmark, Sweden, and Finland, New York, and others. And the basic principles of Vision Zero is that the road environment should be forgiving to human error, that it should be driven by a social justice and equity lens, and that any changes should be data-driven and evidence-based. So now I'm going to talk about the CHASE project summary. So active school transportation and the built environment, child active transportation safety in the built environment. So this just shows, it's a graphic of what the grant was meant to be, that there's a built environment that supports active travel, but increasing safety also increases active travel, and built environment reduces injury risk at home, on the move, and at school. So it had 3 objectives, and I'm going to be focusing on objective 3 because that's the objective that I was partially responsible for conducting. So objective 1 was, what are the determinants of active transportation? What makes it more likely for children to walk or bike to school? Objective 2 was the determinants of active transportation safety. So what makes it safer for kids to walk and bike to school? And then objective 3 is called integrated knowledge translation. And that's a term that researchers use to say, we're going to work with people who can use this information in partnership so that they can use the results of our research if they find that it's applicable to them. So the objective of this was to identify implementation strategies for built environment change at the municipal level to encourage active transportation. And I would be remiss, I'm giving this talk, of course, but we had so many partners. We had partners in all of the cities that were working with us, in the region of Peel, other universities, and Public Health Ontario. And I guess most importantly is the Canadian Institutes of Health Research, which is the federal health funding research body who funded this study. So health accessibility in the built environment. There are links between the built environment and people's health. There's an increased risk for road user groups made vulnerable by the current built environment. And the 2 most common examples are children and older adults. Children, because they're smaller, they're harder to see, they might not have the experience navigating the built environment. And older adults, because they can be slower as they age, and they might also have, changes in their ability to hear and see in much older adults. So changes to the built environment can reduce crash incidents and mediate driver behavior. Density, that's how many people live in a neighborhood. Connectivity, how easy is it for somebody to get from their home or their school or their place of worship, wherever they go, to another place without having to have their trip interrupted by something. And walkability is a measure of how easy it is to walk, how close amenities are, and things like that. And we know that built environment modifications are not implemented equally across communities. And I think at York, we know that very well. We're very close to that Northwest hotspot. And we have, very fast roads. We have Jane, we have Keele, we have Finch, we have Steeles, all very close to the community. And those are all very unfriendly walking environments. So we wanted to dig deeper into the whole concept of equity in the built environment. So we got some focus groups. We had purposeful, so we went and sought out people and said, please come and join our focus group. And we also had snowball sampling, which is when you ask somebody and say, hey, if you know somebody else in your organization or that you work with that might be interested in participating, please feel free to invite them. And we really, really wanted a very broad approach. So we had some policy decision makers, people who work at the city. We had people from transportation. We had people from police services, public health, not-for-profits, schools and school boards, community associations, and we had a few private citizens all participate. And this was done across Canada. So we had people in Vancouver, Calgary, Toronto, and Montreal. So we did key informant interviews with 42 participants. And then due to COVID-19, as everybody experienced, we used a third-party platform to do the focus groups virtually. And so we had a total of 70 participants, and you can see they were from Vancouver, Calgary, Toronto, Peel, and Montreal. So 70 people. We also did what we call resource co-creation. So the first thing we did was an online platform, which I think you'll see in the chat in a minute. And I'm not going to open the link, but we did an environmental scan of road safety policies and found out where there was evidence that these policies were effective in municipalities. We did an iterative consultation process with stakeholders and end users, mostly people in cities, public health, and tried to find out from them, what do they need? How could we present this evidence in a way that would be useful to them? And then, so we did that co-creation and had several versions, and then we did an evaluation. We also did what we call infographics, which are summaries of the evidence, but in a way that's much easier for people to digest than a published literature review paper, something like that. And we did them individually for all the people that had participated. So Peel, Toronto, Calgary, Vancouver, Montreal, Laval, and Surrey. And so in these infographics, and I'll show you an example in a minute, we explained our data sources, collisions, active transport, interviews, and focus groups. We had a summary of that. And then we sent them out to every municipality, and then they gave us feedback, and then we changed it up, and then we did an evaluation. And I just recently gave a talk about our results again at Peel region, and they sent out the infographic again. They really, really found it helpful. So this is an example, and I know it's not big enough for you to read it completely, but we talked about what active school transportation is, what % of children observed were using some form of active transportation, the range. So it was as high as 86% for some schools and as low as 12% for others. And we talked about what factors were associated with AST. So areas with more traffic signals, with adult crossing guards, more local low-speed roads, higher walk scores, and more children. And less AST was associated with areas with more parks. We're not really quite sure why that finding was, but maybe it's the greater distance. I'm not sure. And then we talked about facilitators to changing the built environment to increase active transportation and reduce collisions. The facilitators were cross-sectoral collaboration, guides, policies, compelling data and evidence, which was nice for us to hear, community consultation. And the barriers, of course, money is always a barrier. Sectoral silos, that is when public health and transportation and the police don't all work in harmony, it makes it harder to get stuff done. Prioritizing motor vehicles and the existing infrastructure, because it can be hard to change. So then at the bottom, we gave them, what's the key takeaway? What does this mean for Peel region? And so we just summarized it. And also we provided them with a map of pedestrians and cyclists. And the dots are the percentage of AST use in schools. So each of those dots is a school in either Brampton or Mississauga. And then we mapped onto that the collisions, with the light blue being fewer collisions and the red and yellow were more collisions. And then we talked about what factors were associated with collisions in all cities and in Peel region specifically. So we got really good feedback on that. And then we wanted, that was more looking at the cities globally, we wanted to focus on equity specifically. And what we found was there was an exacerbated risk for marginalized groups and inequities in the built environment change process. So that would include, like what I told you at the beginning, of having to ask, making communities responsible for asking for traffic calming. Some of the facilitators were equitable built environment changes and strategies for inclusive consultation. So not just putting something out and having people come to you, but actually going and meeting the community in their spaces and in their places for them to tell policymakers what they want. So this was just a quote from one of our focus groups. We know that vulnerable populations, school-aged children, seniors, lower socioeconomic status are disproportionately impacted by a built environment that does not support health and safety. Improving the built environment should have more benefits for vulnerable populations because it's an attempt to reduce health inequities. Another quote from Vancouver is inequities in the change process. A lot of it is complaints driven. So if there is a community where they have the capacity to complain or the knowledge on how to complain, they can get elevated. But of course, that favors economic, more socially privileged group. And evidence shows that these are the ones with lower risk for injury. And with somebody from Vancouver Public Health. So strategies for inclusive consultation might have to look differently for different communities. It's not a one-size-fits-all approach. In some communities, you're not going to get anybody out to a public forum. You're not going to get meaningful feedback. So you have to know what would be most meaningful for that community, having multiple pathway points for access. Maybe it's social media, public forums, maybe it's a community event. It's got to be diverse and it's got to be grounded in the community. So current built environment contributes to disproportionate health risks, include equity deserving groups and communities in change processes. Traditional consultation strategies such as complaints or open houses are not accessible. There's an urgent need for a shift in the change consultation process. And a health equity approach to consultation strategies is grounded in the understanding of the values, identities, lived experiences of equity deserving groups, as well as economic, social, and political context. So then I'm just going to talk about the next grant, also funded by CIHR, Road Safety Evaluation during COVID-19, which really wanted to analyze temporal and spatial trends. And this was very much in partnership with the cities, especially the City of Toronto. And I'm just going to show you some data from the automated speed enforcement. So speed cameras, automated speed enforcement was initiated with 50 camera units, 2 per ward in 6 phases. And there was a minimum of 90 days warning. And upon completion, the units were rotated within each ward to a new location. So these were when they were giving tickets, they were mailed to the people, the owner of the car who was speeding in that area. So this is not my slide, it's a little bit messy, but the main point is, this is a graph of the volume of speeds. And at 30 kilometers an hour, pedestrians and cyclists are relatively safe from death. But at speeds of over 50 and 60 kilometers an hour, the probability of death goes up much higher. So the green is like 5 kilometers, the light green is 5 kilometers over, then it goes 16 to 20 kilometers over. And right at the top, the red and the black are more than 11 to 15, or 14 to 15, sorry, and 20 kilometers over the speed limit. And what's really important here is those really dangerous drivers, there are many, many fewer of them after the ticketing starts and even after schools reopened it. So this was really important for the city to know that their automated speed enforcement worked. The other question I just wanted to spend a few minutes talking about is an applied health research question from ICES, which is a question posed by a health system or policymaker in order to obtain research evidence to inform planning. And this is done by ICES for free. So the City of Toronto made this request, and I'm not going to go into the details of the methodology, but it's patients who visited an M postal code, a City of Toronto hospital with a home postal code of an M postal code, or some of the L postal codes from the inner suburbs. And we didn't want to exclude, we wanted to exclude visitors to Toronto or seriously injured cyclists who were mountain biking elsewhere. And we wanted to compare this with how many, because cities use police data to plan their interventions for cyclists and pedestrians. And we wanted to see, we knew the police would be missing some data because they don't go to every collision. They don't, people who can walk away might not necessarily call the police. But we were surprised that police data captured only about 8% of emergency department visits for all cyclists. And cyclist motor vehicle injuries, that means the cyclist didn't fall off their bike or hit a streetcar track, they were actually hit by a car. Police only captured about 58% of cyclist motor vehicle collisions. And pedestrian injuries were somewhat better captured, but police data captured about 54% of pedestrian injuries. And we were also interested because so much of the prevention is focused on cyclists who are hit by a car. We wanted to look at the burden of cyclists who are not hit by a car, because that's also a potential to improve the built environment by making sure there's not grates in bike lanes, or that there's smooth transitions, no cracks in the pavements. And so what we saw was that over time, from 2016 to 2021, there was an increase in non-motor vehicle collisions and a decrease in motor vehicle collisions, which is, I guess, mostly a good news story. We made an infographic that we shared with the city, and they were really happy to have that. The media were super interested in these findings, which was a bit of a surprise to me. And, our summary is that using police data was substantially lower than ED and hospitalization data, and that better ED capture of cyclist motor vehicle collisions and pedestrian collisions, but still only about 50%. And same thing for more serious injuries, which is data I didn't show for this. So data linkage would be the ideal way to move forward if we could link police and hospital data. The applied health research process was key. The results will directly inform policy in the City of Toronto, and 2 other regions have initiated their own requests and brought about the attention to the need for different data approaches. And so the last thing I'm just going to mention is our ongoing project called Capacité, which is in 9 Canadian cities and Melbourne, Australia, examining the implementation effectiveness of transportation interventions, particularly all ages and abilities bicycling networks, and speed reduction to support health, mobility, and equity in cities. And this has a plan to develop a novel implementation science framework and a toolkit for municipalities. So in conclusion, working in partnership with municipalities can address some of the barriers and facilitators to changes to the built environment that promote active and sustainable transport. Researchers have access to funding, methods, and data that can help municipalities understand their environment. Including various players in the process leads to more robust findings, for example, public health, transportation, not-for-profit organizations, etc. So acknowledgements, I wanted to thank CIHR for the funding, of course, and there are many, many, many people involved in all of the projects, and these are just some of them from Calgary, Sick Kids, Parachute Canada, Public Health Ontario, York, Toronto Metropolitan University, and UBC. Thank you.
Thank you, Alison, for that very timely and informative talk. We now have time for questions. Please use the Q&A function at the bottom of your screen to ask questions. And for those of you watching live on Facebook, you are welcome to submit any questions or comments that you may have through the comment section for the video. Alison, have municipalities been receptive to working with you in this research?
They have. You know what, Isa, thanks for asking that. They've been really, really receptive. And I think municipalities and regions that have a lot of integration between transportation services and public health are particularly keen because they can see the power of having the data. You saw the City of Toronto was the one that initiated that request for cyclist and pedestrian data, and they really are going to use that and build on it. And as I said, then once the City of Toronto got it, then Niagara wants it. Now Guelph has done their own analysis. So it's really got a bit of a snowball effect. So I think that the key thing is, though, to not pretend that we know more about everything than they do. Researchers have a skill set, but it's a limited skill set. They
Mhm.
know their cities, they know their processes. So it's really important to do things like the way we talked about co-creating. It's not just us saying, here's your data. It's what can we take from this data that we've gathered together that will be useful to you as you move forward. I think that's a real critical success factor.
Absolutely. The next question, what advice would you like to give researchers wanting to do research in this space?
I think the first advice that I would give would be to build the relationships, get to know the people who are making the decisions, get to understand what their capacity is, what their limitations are, their perspective. I think because once you have the relationships and they can trust you, it makes it a lot easier to move forward. So that would be the number one piece of advice. And also not to rush it. Research tends to be slow anyway, but don't try and jump in and do too much too fast because they can't possibly make changes. Like, for example, to the built environment, you need to, if you're going to build a bike lane, you need to plan it, you need to have a budget, you need to have all sorts of things in place. And then we're happy to help you evaluate it, but it can't be just like 2 weeks or something like that. It has to be a long process.
In terms of building relationships with the folks or like organizations that may be able to assist the researchers who would like probably undertake research in this field or space, how would they go about in building those relationships? Will they be going to events, activities, or people that they know in terms of connecting them? Or how would they go about making those relationships in particular?
So I think it's really all of the above. I mean, usually the first step has always been, and Dr. Linda Rothman at TMU was very integral in doing this. She did her whole PhD thesis on kids walking and biking to school and what were the environmental things that made it more likely for them to be hit by a car. So she asked the City of Toronto Transportation Services and the Toronto District School Board, hey, can we come and just show you our findings and open the door to the conversation? I think these folks are really busy, right? They do a lot, they work hard, and you really have to make it worth their while to work with you and to show, okay, we can do this. What do you think? So it's not really, but yeah, I think that's the first thing. And then sometimes they have active transportation working groups, and then we get to meet them. So it's sort of the relationships build if they see value in what we're doing.
Absolutely. How do you feel about drivers paying tolls to enter the city to help with traffic density?
Um,
For example, the 407.
yeah. I mean, it worked in London, England, right? But that's a much bigger, denser city. I guess what I would say is if people were serious about this, we need to make sure that our active transportation is readily available and that it's accessible to people with all different levels of mobility. I think we need to make sure that our public transit is reliable, on time, and has the capacity to deal with people who aren't driving in the city. And I think it was interesting. I was just at a summer institute with a bunch of cities from across Canada, and their favorite word is pilot. Let's pilot it. And so if the cities were asking me what we should do, that's what I would say is make sure the infrastructure is there so that people don't need to get around in a car, and then do it as a pilot and then evaluate it. I mean, I think hypothetically it could work, but I don't have enough evidence to really have a very strong opinion on that.
Okay. What is the most rewarding or the most challenging aspect of this type of research?
The most rewarding is seeing, all those bike lanes on Bloor and the Danforth and all the people riding and seeing kids walking and biking to school. A full bike rack is just an amazing thing to have at a school because that means that that's how kids are getting there. And I think that I really firmly believe that it's both a health equity thing and a health thing. We are all healthier if we move more. And if we can incorporate movement into as much of what we do as possible, that's great. The most challenging thing, I think, is that this type of research can be a bit at the whim of policymakers, politicians. And so there is a big aspect of this that we just absolutely can't control. And if we have a mayor who says, you know, that we're not building bike lanes, that means we're not building bike lanes. But if you look at Montreal, for example, there was a mayor who said, I want people to walk and bike everywhere. And active transportation in Montreal is through the roof all year round. There are lots of, they clear their bike lanes of snow, and there are lots of people that bike in Montreal all seasons.
So it's that political goodwill of the politicians as well to have the buy-in.
Exactly. Yes. Yeah. And, you know, I have to say in North America, for sure, we love our cars. Everybody, you know, so many people say, what, you're taking parking spots away? We need more parking spots, not less, and things like that. So I think it's always going to be a bit of a balance. And I would love to see a greater shift away from car culture and towards more active and sustainable transport.
Right. In your presentation, you shared next steps. That's the road safety evaluation during the COVID-19 among vulnerable road users in Canada, the RECOV grant. You mentioned about two objectives. The first objective was to analyze temporal and spatial trends in traffic collisions by transport mode, walking, cycling, and motor vehicles in relation to COVID-19 pandemic. Could you go in depth with this objective?
We don't have the results yet, which is one of the
Okay.
reasons why I only presented the automated speed enforcement.
Right.
But I can say that all of those were dramatically impacted by the pandemic, and the preliminary results show that there were way fewer motor vehicle collisions because people weren't driving to work. They really didn't have as many places to go as they did pre-pandemic. The bicyclist collisions went up a bit because more people were riding their bikes, and maybe some of them were people who hadn't previously had as much experience biking in the city. That's our hypothesis. It's a bit hard to test. And pedestrian injuries, I believe, went down. But the data is not completely finalized, and we're doing all kinds of trends because we need to put sort of statistical testing around it. So that's why I didn't present that, but it's on its way.
Okay, excellent. Okay, thank you so much for being with us today, Alison.
Oh, Isa, it was my pleasure. It was lovely to come, and I love my research and I love talking about it. So I hope people enjoyed it.
Likewise. Thank you so much. You are now welcome to turn off your video. We have one more poll question for the audience. How would you rate your knowledge of today's topic following this discussion? It should pop up on your screen right about now. Scholars Hub will be back on Wednesday, July 17 at 12 p.m. Join us for the last session of the summer, Thriving, Not Just Surviving, Mental Health in the Workplace with Duigu Brichik Gulseran, Assistant Professor, Faculty of Liberal Arts and Professional Studies. To register for that event and learn more about upcoming sessions, please visit yoq.ca alumni and friends, which will be shown on the chat and screen. Thank you all, and be well.